And therefore, Dr. Kuchipudi, what must we be doing right so that it doesn't reach that situation?
Yeah, that's a great question, and that is the most important question we should be talking about. As I mentioned, this virus is
Yeah.
now known to be around since 2020, almost 4 years, and now it's globally distributed and has caused several unprecedented infections. And this tip of the iceberg evidence that we saw is when cows explained unexplained disease. It was accidentally found to be H5N1. But the biggest threat is this: we do not know what other animals might be already getting infected and circulating the virus in the nature. Because we do not normally go and test wild animals, and there are accidental discoveries if a wild bird or wild animal is found dead. So the call for action now is, since this virus is checking off most of the alarming trends of a potential deadly pandemic virus, we have now time to act, and the action should include the different agencies in multiple countries, the public health, the veterinary animal health, and wild health agencies, to do a much more integrated surveillance to better understand where the virus is and what animals are being infected. So we first understand how the virus is changing, and what is the risk to public health. And number two is we can also understand what are the different ways in which people could be exposed, so we can minimize that risk of exposure. So I think that what we call as the One Health approach is really critical. The concept of One Health recognizes that the animal health and human health are inextricably linked to the environmental health. So therefore, the call to action is now we need to really do an integrated surveillance to better understand. And the other point I would mention is that when we are encountered COVID-19, the virus never gave us any indication. All the world has caught by surprise. But this time we have an opportunity and a window to act. This virus is now demonstrating a potential pandemic threat in the plain sight. And we may have a window in which we as the world can react and prepare. So therefore, the call is to do a better surveillance in all the countries to understand and also develop proactively countermeasures such as vaccines and diagnostic tests, so we are ready if and when the situation happens.
Yes. Dr. Kuchipudi, I have paucity of time, but let me ask you three quick questions that social media had people talking about, and I just want to give you, I just want you to give brief answers to me on that. One is that they said that there's no reason to panic, and this is not such a big thing, and this is perhaps the pharma industry which is trying to create some sort of hype around this virus.
Okay, my response to that is based on the experience we have from COVID-19. The difference between acting before a potential public health threat happens versus reacting to public health threat is massively different. So, for example, the response to COVID-19 costed trillions of dollars. So if we prepare ahead of the time, with a fraction of that cost, we'll be far better positioned to address this epidemic. While the idea is not to really panic, but it is important to be prepared, because we already just experienced how devastating a respiratory viral pandemic can be to the way of life and the society at large.
Okay. Second question, Dr. Kuchipudi, how much of threat is it there for it to travel from the US to other parts of the world now that we have one human case of H5N1 in Texas?
Okay, this is really important. So one thing I wanted to mention is that this virus is not just present in the US, it is almost globally circulated. And the human case is one instance that was found in Texas. But this is not the first time also. So we know more recently there is a death of a college student in Vietnam. And previously there was also a human case in Cambodia. So it is important to recognize that the virus is currently not capable of transmitting from person to person. So therefore, there is no imminent public health threat. And also, there is no risk of travel from US or any country for that matter.
Okay, quickly, my last question then. one of the first questions that people have when bird flu arises is, should we stop eating non-veg then?
So this is also a very important question that I think people need to understand, is that the risk of virus transmission is for those people who have occupational or other contact with live birds, those that work in poultry farms or
Okay.
other places. Once the bird is processed and the meat is cooked, the virus is very fragile and easily destroyed. So there is no food safety concern from bird flu. So we can continue to eat however we have always done. And bird flu does not transmit by eating chicken if it is properly cooked.
Okay. Yeah. Okay. Important point there. Dr. Suresh Kuchipudi, we'll leave it there. Thank you very much for joining us on Mirror Now and helping us understand H5N1 and the scare that has arisen out of bird flu once again. Thank you very much.
Thank you.